What's up, everyone? This is Larry with Yunique Medical, and I am honored to have the awesome Dr. Turner with me today. She's pretty popular in her space, so I'm excited to actually get the opportunity to talk to her. Dr. Turner is the founder of Vine Medical Associates in Roswell, Georgia. She's double board certified in family medicine and anti-aging and regenerative medicine. Among her accomplishments, she served our troops as a physician in the Navy, which is really awesome. And she's an award-winning professor at Emory, and she's faculty at the International Peptide Society. So bottom line, Dr. Turner is a peptide ninja. So that's why I like to talk to her as often as I can. She's somebody that I text when I have hard cases. I'm mostly in the wellness space, but she sometimes takes care of some pretty sick individuals. So she's someone that I definitely use as a resource when I have to. So Dr. Turner, thank you for talking with me today. How are you doing?
I'm great. It's a beautiful day in Georgia.
Oh, is it good? It's nice here too. We're lucky that we don't have a lot of cold to deal with. Lots of sunshine.
Betsy a few weeks ago, and she had a foot of snow.
You're kidding.
Yeah, poor thing.
No, I'm glad I'm not in the cold for sure on top of all this. So it's a crazy time right now with this COVID thing going on. You know, that's not what our talk's about today, but it's definitely a factor in all of our lives, wouldn't you say?
It is. It's interesting. Georgia just opened up, and so we got the gyms are open, the salons are open, bowling alleys, and the tattoo parlors are open.
That's an interesting one. I know we were just talking off camera or off this recording that you were able to go get your workout on, so that's awesome.
Yes, it was great. I had chest today.
Good. And then you can start getting a hair appointment. I definitely need one. This is starting to look a little ratchet, but we don't have that opportunity right now. All right, so today we are going to talk about something new, something that I haven't heard anybody talk about. So I'm really excited to not only talk to you, but learn something in the process. So we're talking about colonocytes, butyrate, and how it affects the cellular milieu. Milieu happens to be one of my favorite words, by the way, so I'm glad that you put that in there. So start talking to me about it. Let's talk about substrates. Let's start from the very beginning and how this all works and gets tied in.
Well, so we do a lot in our practice. Most patients who come to us with anything, we're going to start by looking at their intestinal function somehow. And so it's a significant part of how we help them and help them to get better is fixing their gut, the way we talk about it colloquially. There are so many diseases that begin there, and such an inflammatory storm begins there. So this has been part of my practice for many, many years. But whole concept of why this happens and how it happens, or actually how the dysfunction occurs, was such a new insight for me to learn that I felt like I had to share it. And it makes so much more sense, and it gets so much more buy-in from patients to understand why exactly this problem is happening, rather than just saying you took antibiotics and now you're killed off all your good bacteria, and so now you need some probiotics. Now I actually understand why this is specifically relevant for the colon cells, for the way the body works with increasing the inflammatory storm. You've probably heard about on TV now, this whole cytokine storm that everyone's talking about, and the inflammasome that seems to be such a new thing. But this has been something we've been talking about for years. So this whole concept of how the intestine works and how it doesn't work became a way that now I understand much more clearly how this whole process works and falls apart.
Okay, and you said that you do testing in your clinic, which we all kind of do. I think we know that the gut health and your body health, they're completely linked. What test, not that we're promoting any particular company of any sort, but what testing do you like to do? Do you like to do stool testing, breath testing? Do you do it all? Which tests do you like to do in your particular practice?
Well, we do practice what I like to call personalized medicine. So we really do, every patient is different. So when I say that, I know it sounds a little cliche, but it is really, every patient is different. So in some patients we'll do, there's a lab nearby that does PCR testing. PCR is where they test for a unique DNA sequence to a particular bug. And so there's several labs that will do that. So if I really think there's an infectious cause that's contributing to the patient's symptoms, I'm going to look for that infectious cause. there are several labs. MDL does a pretty short number of bugs, common things that you might run into frequently, Enterococcus E. coli, h-pylori, several parasites, and a couple of viruses, enterovirus and adenovirus, and then and a couple of yeast. And so that makes it a simple, short, sort of the most common, hitting the high points. There are a couple of labs that do much more extensive testing of PCR, like Dr. Ferree out, I think he's in Arizona, I'm sorry, I forget exactly where he is, does something like 40,000 bugs that he tests for in his PCR test. And then also Periomics is a similar company that tests for thousands and thousands of bugs, very unusual bugs, things you might not see elsewhere. And so if you really think you have an unusual bug, we had a gal who had heart valve replacement, and her hospital actually sent them out a notification saying that they had this unusual Mycoplasma chimera that was common to infest these cooling systems that they use during open heart surgery, and they were concerned that she may have been exposed to this bug. And so we actually were able to find it using that Periomics testing.
Yeah, that's good. You know, we definitely in clinical practice try to find the least expensive tests for the most maximum data. And like I told you, we don't do necessarily weird and unusual. So I'm glad that there's people out there like you that can do some of that stuff and have better expertise. So circling back to the colonocytes, tell me a little bit about those, a little more specifically. What are they? How do they work? What do they do?
So these are the cells that line the inside of your intestinal wall, particularly your colon wall.
Okay.
And when we think about what does the colon do, most of the absorption of nutrients occurs in the small intestine. So from the part just past your stomach down to where it hooks up with the large intestine. When you hook up with the large intestine, you're not doing as much absorption of nutrients anymore. Now you're really doing water balancing. So if you think about constipation, diarrhea, foods that you might eat that might cause constipation or diarrhea, that sort of thing, that water balance to pull back in the water that's been used to help with the digestion process. Now those colonocytes, that's one of their big jobs, is helping with balancing how much water does the system need and how much can I let go back out through the stool. And certainly in the case of an infection, a lot more would be allowed to be released with the stool, and you may become dehydrated as a result. So that's one of their jobs, is helping maintain fluid balance in the whole body.
Okay. So when we're talking about the colonocytes and we're talking about substrates and energy metabolism, particularly butyrate, which is a short chain fatty acid. So how is this all coming into play when it relates to energy production, immune system, functionality of the cell? How does all this start to get pieced together in this cellular milieu?
So I think this is fascinating. These are the things that I geek out on. You never want to be someone that's interesting to a doctor or a provider because this is very exciting to me. So
Okay.
if you think about every single cell, not just colonocytes, all cells, eyeball cells, tongue cells, heart muscle cells, everything, has a choice of which substrate it uses, meaning what food it likes to eat. So just like you might prefer broccoli over carrots, the cells have a choice of substrate that they prefer. They can be flexible and use several different options. And if you think about trying to burn fat, well, some of them cells can choose to burn sugar or fat or protein. And if you think about someone in a starvation situation where they lose their muscle mass because they're not taking in enough protein, or if you think about elderly patients, that's because their bodies, their cells are choosing to use protein as a substrate or choosing to use carbohydrates, or particularly sugar, glucose, as a substrate rather than using fat as a substrate. These colonocytes prefer this particular unique fat called butyrate that is produced by the good bacteria or we call them commensal bacteria in the intestine that eat fiber and convert it into butyrate by a fermentation process. When they take that fiber by fermentation, it converts into the preferred fuel source for those colonocytes. So they sit around and yay, you're making my favorite food, this is terrific. And then they take in the favorite food, They use oxygen to burn that favorite food and create lots of energy by burning the favorite food that they eat, that they take in from the bugs in the intestine.
Okay, thank you for that. That was very interesting. So how does this relate maybe if somebody was in a fasting state and they like to do intermittent fasting and their bodies were naturally burning fat for fuel? Does that help this scenario at all?
So it's interesting. It really depends on what the state of what the cellular milieu is at the time, right? A cell is going to make a different choice among the available substrates based on several options. Number one, it's going to make a choice based on whether the substrate is available. So if a lot of butyrate is available, obviously it's going to choose that and it prefers to use that. If there's a lot of glucose available, it's going to choose that. If there's an inflammatory state happening, rather than taking the glucose and using that to make a lot of ATP, it will do a shortcut where it uses no oxygen and makes a very little amount of ATP, but it can do it very quickly. So now the cell can get what it needs, it gets it quickly, but it doesn't get it in the most efficient or organized way. So that cell has now lost its metabolic flexibility or ability to choose the substrate based on which one will be the most efficient for it.
Okay, which is a scenario that we don't really want. We want our bodies to be using the correct fuel at the correct times so that we're running from a peak performance or optimization standpoint. Okay, so maybe talk to people a little bit about how this bacteria in our guts work, the good versus bad, and what it means to be aerobic versus anaerobic, and why the colonocytes prefer a particular environment over another.
Right. So if your colon cell is taking in butyrate from the commensal or good bacteria, and it is taking the oxygen from the inside of the intestine. So think about the inside of the intestine. This is a very low oxygen state. The inside of the intestine where the stool is very low oxygen. All of it's being extracted into the cell to be used in oxidative phosphorylation to make energy for the cell. And so the cell can take all of those substrate options with oxygen and make a lot of energy that can be used to do all the things it needs to do to balance water, to manage the immune system, all the things that cell needs to do. So because it uses oxygen to make that energy, now that inside the lumen or the inside of the colon where the stool is a very hypoxic or low oxygen environment because it's being sucked out to be made into energy for the cell. Mm-hmm. So let's say you go and you take antibiotics. Now you kill off those bacteria that prefer to be in a very low oxygen environment, these anaerobes that prefer to be in a very low oxygen environment. And you allow the overgrowth of the few facultative anaerobes. These guys can handle being in a low oxygen environment. They don't really like it, but they can do it. Or aerobes that really prefer to be in an oxygen environment. So now these bugs that begin to overgrow because of the absence of the anaerobes, now they begin to steal the oxygen from the colon cells. So now the colon cell is stuck. We've changed the cellular milieu. So now the colon cell is stuck without enough oxygen, and it has to begin to do anaerobic metabolism. So like I mentioned before, it takes that glucose and now begins to make oxygen in a very inefficient but quick way, because it's the only way it can in the absence of oxygen. The cell begins to transcribe new enzymes from its DNA. It begins to now not be able to do the very efficient, very high energy producing mechanism because there's not enough oxygen for it to do that process. So it begins to switch how it functions. The cell itself begins to switch how it functions. And it's all because of the presence of these facultative anaerobes who don't really care for the low oxygen environment, or aerobes who like the oxygen environment, and now they're using all the oxygen and not allowing the colonocytes to have the oxygen go to them, and maintaining that low oxygen environment of the stool itself or the lumen of the colon.
Okay, thank you. So if, for the people who are watching, this, what are some actionable things that they can do? So, you hear about probiotics, I mean, this, that's a very big industry. I don't want to get too controversial, but are you a prebiotic liker or are you a probiotic liker? Or based on certain scenarios, are you using both? So where's kind of your headspace at with that?
It really depends on the patient.
Sure.
I really think if you give the body what it needs, and the research proves it out. There was a great study that was done in 2015 where they gave antibiotics to rats and they watched their colonocytes start to fail. They decreased their cellular efficiency because of the oxygen was being stolen by these oxygen preferring intestinal bacteria. And so now the cell's functioning less efficiently. An inefficient cell sends out a mayday signal to the rest of the body to say, hey, there's something wrong. I'm not functioning as well as I should be. Somebody come and help me and see if there's something going on. So it sends out chemical messengers to the rest of the body. And those chemical messengers draw inflammatory cells to the area to say, what's happening? Is there something we need to worry about? Now we begin this inflammatory cascade, and the cells themselves, the inflammatory cells themselves, also change the way they react to things. They change what enzymes and chemicals they prescribe, saying, hey, the colon cells say there's trouble, come on down here and let's see what's happening. And now everybody's got this inflammatory storm happening. And so now you've got the inflammatory chemicals all happening. That begins to cause this, a lot of people call it leaky gut, this decrease in intestinal or increase intestinal permeability or decrease in the integrity of that cell wall to now allow things to come through the wall that shouldn't be there. Water balance goes off because the cell's not able to as efficiently function as a water balanced cell. And now you have all these bugs that are in the intestine that are also creating an inflammatory cascade, drawing the inflammatory system to them. And you've heard of people talk about a gut feeling. Well, now you begin to get that brain reaction, brain fog, maybe depression symptoms, etc., that can come from the presence of those oxygen loving or oxygen preferring cells that are bacteria that are now in your colon. So what do we do about that? We know from the study in 2015 I mentioned a minute ago that if you treat those same animals with rectal butyrate, the preferred colon source, now the cells themselves, the fuel source for those colon cells, now those cells get what they need, so they begin to function, drawing the oxygen out of the lumen. These oxygen-loving bacteria now begin to die off, and now you can begin to grow the normal bugs. So if you're doing the things you need to do to take care of yourself as far as your diet and lifestyle things that you're doing, and not creating more of an inflammatory storm with toxic environmental exposures or additional antibiotics, now you're allowing that cell to do what it needs to do. You give that cell some butyrate, it gets the energy source it needs, it decreases its inflammatory storm, the inflammation begins to go away from that area. Now the cell begins to take the oxygen from the lumen, and the good bacteria begin to thrive again, or the commensal bacteria begin to thrive again, because they're in a low oxygen state.
So what types of prebiotics do you like? And do you supplement with butyrate?
Yes. So there's a couple of ways. You can do that. So I really do prefer using prebiotics rather than using probiotics. There are a couple of cases where I will use probiotics. I do like that Saccharomyces cerevisiae. There's several companies that make it.
Mm-hmm.
And using that specifically when I have to give antibiotics for something, I'll give a few days of that. And sometimes that alone will do the trick. I really try to limit the number of days I feel like I have to give antibiotics, but sometimes you don't have a choice. So I will definitely will give patients butyrate, and I can give that in one of two ways. There's several ways, but the two main ways are either by giving a rectal butyrate infusion, and your compounder, your local compounding pharmacy can do that for you. It sort of depends on how severe and how long this disease process has been going on. And so if let's say it's an ulcerative colitis or Crohn's disease patient who's had this disease process for a while. Let's say they had a recurrent strep throat infections when they were a child, so they took antibiotics, every 2 or 3 months for 2 or 3 years as they were a child before they had their tonsils taken out. And so they've been dealing with this for years and years and years. And now we get to a place where we can treat them. I'm probably going to start with a rectal butyrate infusion. You can give them, there's a couple of companies that make a bioavailable butyrate that's orally available. One's probutyrate by Tesseract. I use that a good bit.
Tesseract, okay.
And I like that combination. So using both the butyrate, either rectally or orally, and then using a good quality prebiotic. And so there's a couple that I like. Designs for Health makes Paleo Fiber RS. Bimuno uses that daily. That one is a really good one. I really like that one. There's several. I really like the hot chocolate cocoa ringa that's made with moringa. It has 6.7 grams of fiber, so that's a pretty high amount for a powdered fiber source, and it's delicious. You can put it in your coffee. So I love to do the combination of those two, butyrate plus prebiotics, to see if we can get that colonocyte to work again. And so especially if you have patients who are chronic diarrhea or chronic constipation, those may be good choices for you to use to get their intestines back in balance. It sometimes takes 4 to 6 weeks, especially if they've had it for a while, for them to see a big change in that. And you may need to add other anti-inflammatories just to help the cells calm down from this inflammatory storm that's been going on. So there's all kinds of things you can do. Fish oil can help, and anything that you would normally do to decrease inflammation, low dose naltrexone, pentosan, anything that you would use to decrease inflammation in a cell or in a cellular milieu, that's going to help the cell to be able to function optimally. So that you could add all of those things too. But specifically for what we're talking about, I would probably use, I probably number 1 and number 2 use Bimuno and probutyrate by Tesseract.
Perfect. Thank you. Yeah, I didn't even know that there was a butyrate enema option until you sent me over the information. I was like, oh my goodness, are they doing that over there? So the answer is apparently you are.
Yes.
Yeah, that's awesome. And, not to go off on this tangent, but I do have my peptide nerd shirt on. So I guess in a lot of these bowel cases, your autoimmune cases, which you have a lot of typically, and you're working on the cells and the efficiency of the cell, I'm sure you're going to be leveraging some peptides at the same time.
You got it. Yes, always. And so you're working on decreasing their inflammation, and you're at the same time working on improving their cellular efficiency. Depending on how inflamed they are to begin with, I'm always going to work on their inflammation first and then improve their cellular efficiency as quickly as I can after that. So you're probably going to get, it's layered on depending on how severe the patient's illness is.
So you have the healing component, you're going to have the building the good bacteria component, you have the cell efficiency component. And obviously these are going to be big because you do a lot of talks on autoimmune disease. So when you have an autoimmune problem, self-included, I've had the leaky gut conundrum scenario for a very long time. So I know personally when your gut goes sideways, how it can affect your ANA and any kind of immune status. So I'm sure that in your clinical practice, you are doing this a lot. You have a large group of some unhealthy clients or patients.
And it's amazing because, when I first went to medical school, I heard a lot of people that would come to me and be unhealthy. And I would say, well, it's just because your diet's bad and your exercise isn't right and your lifestyle isn't right and your toxic exposures and all those things. Well, then I started meeting people who were sick and we're doing all those things correctly. So that's where I am now is meeting people who are well, healthy, people you would be functioning well, that don't use BPA plastics and put everything in glass or stainless steel or whatever. They're doing the best they can, not using dry cleaning, not exposing themselves to pesticides or herbicides, exercising on a regular basis, eating well, and yet they're sick. And so those are the patients we run into now.
Yeah, that's kind of, you've basically summed me up in a nutshell. We can always be better, we can always do more and to try to optimize and not live in a bubble at the same time. So, a lot of my clients, I know they come in all the time, top 2 things that they complain about: tired, so fatigue, and weight gain, especially if it's a female client. So how does all of this and what we've talked about work when it comes to those symptoms, or maybe rectifying some of those symptoms, so that if I have a woman who's exhausted, stressed, probably has a messed up gut, gaining weight, can't shed it, even through starvation sometimes. So if we're working on these colonocytes and some of the cellular milieu, is this an avenue to maybe help with those symptoms and get those women and men to not have brain fog and help them lose some of that weight that's just stubborn and not going anywhere?
Absolutely. And we use that bioimpedance analyzer to work on, to look at this. So sometimes you'll see that total body water lower than extracellular water. They have a little more extracellular water. This can be the cause. Your colonocytes aren't doing the correct water balance that they need to be doing. And so these patients are holding on to extra water because their colons are maintaining this inflammatory state. I made the mistake a couple of years ago of trying to work on clients always by revving up their thermogenesis to try to get them to lose weight.
Mm-hmm.
And truly, most of them, especially if their BMI is greater than 30, I almost always have to start with working on their inflammatory state before I work on their weight loss. So you start by treating them, simple, inexpensive, low-dose naltrexone. You can work on things like their of course, their diet, what their inflammatory foods are.
Mm-hmm.
If they have foods that they're allergic to, certainly that. But if you're thinking specifically about working on the optimal function of their colon, I think you're going to see a bunch of inflammation decrease because you're optimally treating that colon milieu.
Awesome. I'm definitely going to put this into my little toolbox when I'm working with some of these clients. And maybe we can have another talk about weight loss in general, because you touched on some really cool things. I made a pivot, working with you guys and learning about the immune system and inflammatory processes. When you have a woman coming to you, or a man that's saying, I need to lose 10 pounds, and you're trying to sell them conceptually that it's their immune system and inflammation, that's a toughie. Just recently started getting better at it, and it's a lot of education, but I can tell you firsthand, it works. When you have those people that can't lose weight, they feel like crap no matter what, and they've done all the other things. When you work on the inflammation, you work on oxidative stress, you work on the immune system, magically they start to lose weight again. So
as opposed to working on calorie restriction,
correct.
Stress those cells even more, just like we talked about with the colonocyte. If you're not giving it the energy source it needs, then it's going to cause an inflammatory process. And remember that people have probably stuffed away inflammatory chemicals in those fat cells for years. So when they begin to lose weight, they're going to create an inflammatory storm. So you have to be aware that that may happen, and they may feel worse when you first start getting them to lose weight. So preparing their body with an anti-inflammatory regimen and antioxidant regimen is probably a good way to start.
Okay, we won't touch on that anymore. I think I want to save that for another conversation. But that is really, really, really good information. I love where this went and kind of what we learned. So tell everybody where they can follow you or find you and look at your content, where your practice is maybe, and how to contact you in case they need your services. So please let everybody know.
I'm in Roswell, Georgia, which is just north of Atlanta. We're right outside the perimeter. And I have a practice of 4 providers here that see patients. We have a naturopath, a dietitian that works with us in the office. We have local good referral people that can do some exercise education, some personal training or physical therapy if needed, some massage therapists that are local that are very good. And so it can be a whole medical vacation if you wanted to come and have that be the case, especially now that we're doing telehealth visits so often. We can do new patients by telehealth, which is unusual for us. Normally we have to have patients come to our office, but we can do remote new patient visits now. So that's a nice plus.
And are you on social media platforms that people can follow?
We are. It's Vine Medical Associates, and it's on Facebook and on YouTube.
Fantastic. Okay, so I'm going to ask my last question that I prepared you for. I like to ask everybody, what's their favorite peptide and why?
That's a tough one.
Isn't it?
I would have to say, dihexa,
Okay.
because I think I've seen, although inconsistent, the most beneficial results. And it's been patients who have dementia or ALS or other neurodegenerative diseases. I have a stroke patient who've had pretty amazing outcomes by using dihexa. And again, it's not 100%, but in the patients in whom it works, it's very effective.
Awesome. Once again, we'll save that for another talk. If you're wondering what mine is, it's thymosin alpha 1.
Yes.
Hands down. I've seen it work in the clinic and with myself. It just had some profound effects. So it's been pretty amazing.
Tell me about patients you've used it in.
So I get a lot of these chronic fatigue people that are well. Okay. So they look great. They're in shape. Maybe they got a little bit of weight to lose, but they just are tired constantly. And my demographic is a lot of entrepreneurs and business people. I've got some doctors as well, to where they complain constantly about just fatigue and brain fog. And, you know, once you optimize the diet, once you've optimized the hormones, once you've optimized all that you can, and I'm just like, okay, we really need to have the immune system conversation, which again is a hard sell. Guys just say, give me more tea. Ladies just say, I just want to lose 10 pounds. I could care less about this immune thing. So I see it in those cases. And once you give them the thymosin alpha 1 and you balance the TH1, TH2, and there's a shift, the fatigue starts to lift, they start to lose the weight. And I said, okay, without doing tons of testing, it's something easy that we can try. And I'll give them a decent dose of it in the office just to see if they feel anything within a couple of days. And they usually do. And then I run a lot of Epstein-Barr, viral type panels. And I don't personally see the titers go down much, but you get it in a subjective response. So they just feel exponentially better, usually by a week or two. So when you have someone that's tired all the time and that lifts, they think you're a magician. And I'm just like, no, I just learned some really cool things from some really cool people, and I'm able to offer them and change some people's lives. So that's where I use it a lot. What's that?
It's why we went into medicine, right?
Absolutely. And it's been fun working with you and the IPS. I mean, I think that we look at things a little differently, and it's just been game changing. Okay. Well, I enjoyed this conversation. Thank you once again for talking to me, and I hope we get to do some more.
I do too. I'll look forward to seeing you at Mastermind.
Yes, I can't wait to go. It's a bummer that that we couldn't go to this last one.
I look forward to seeing you too. You take care.
You as well. Thank you.
Bye.